So hello everyone. This is the second paper from the Siren study, and this one answers a pretty interesting question, a pretty important question. If you remember from the clinical trials of both the Moderna, Johnson & Johnson, and the Pfizer vaccine, all of those vaccine trials, which were very good trials with like large numbers of people, but they were designed to just look for symptomatic infection. So they did not test people unless they had symptoms. So what you did not know is, did it stop asymptomatic infection? And as a corollary, does it improve, does it reduce transmission? Because asymptomatic people will transmit disease and we won't know about it. So those studies could not tell you if it reduced transmission or if it reduced asymptomatic spread, because they were just not designed to look at that. The only thing they could tell you is, yes, it was effective at stopping symptomatic infection. The Siren study basically, because in order to tell if they have asymptomatic infection, you would have to test people regularly whether or not they had symptoms. But their study was designed only to wait until they had symptoms and then you would test them. The Siren study basically tested all these people every 2 weeks, whether or not they had symptoms. All right, so I'm going to summarize the paper, and then if you just wanted the summary, you can just stop watching the video at the end of the summary. If you want the nuts and bolts, we'll continue. So most of the people in Europe got the Pfizer vaccine and a little bit of the AstraZeneca vaccine, but most of them were the Pfizer vaccine. So this data is mainly looking at the Pfizer vaccine. So what they did is they enrolled about, hold on, here we go. They enrolled about, I think, 23,000 people into this study. Yeah, 23,000 people in 104 sites. So, huge numbers of people, mostly women. And basically, if you want to know the nuts and bolts of it, here it is. For both asymptomatic and symptomatic disease, a single dose of the Pfizer vaccine showed an effectiveness of 70%, and 2 doses were 85%. So what this shows is the 2 doses of the Pfizer vaccine were pretty much the same as previous infection. Because if you know from the previous video where we looked at whether previous infection with antibodies protects you, that was 84%. 2 doses of the vaccine are 85%. So very similar. So for the Pfizer vaccine, under the conditions of the alpha variant, are 85% effective for both symptomatic and asymptomatic disease, which is very comparable to the 84% of previous infection with antibody. Okay, so that's the summary, and we're just going to go get into the nuts and bolts of it and find some kind of interesting things that you notice by looking at the data directly. So I'm scrolling down. All right, so here is okay. Here is the table 1, which talks about the study participants. Okay, so most of the people were negative for previous infection. Okay, so you had basically about 16,000 that were negative and about 8,000, a little over 8,000 that were positive, so had previous infection. And then the vast majority of them got vaccinated. In terms of gender, looks like more men were vaccinated than women, so 91% of men and 81% of women, because you could opt out if you wanted to. And then in terms of age group, it looks like the older people were more likely to be choose vaccination. So in the 55 and over group, it was 92%, and then basically 92% in the 45, and then 88, and then 80%. which makes sense because younger people do better. They have less problems with COVID. So these people in this age group were probably thinking, I'm young, I'm healthy. Why do I need to get the vaccine? So a higher percentage of them opted not to get the vaccine, whereas the older people were like, well, we're the ones most at risk. We should probably take the vaccine. So most of them decided to do it. In terms of race, the white people were the most likely to accept the vaccine, and black people were the least likely to accept the vaccine, with Asians kind of in the middle. Let's see. And then this is that index of deprivation. So least deprived is 5, most deprived is 1. So what you notice is that the wealthier people were more likely to get the vaccine, or maybe have more opportunity to get the vaccine, and the most poor were least likely to accept the vaccine or have the least opportunity to get the vaccine. And then this is by group, which is not super. I mean, this is by geographic area, which is not very interesting. And then by group. So what you'll notice is the highest uptake is amongst doctors, 92%. And the lowest uptake is amongst like security people. And nurses had a relatively lower uptake at 87%. And then what's kind of interesting to me is that if you look at how often did these people interact with COVID patients, the people that interacted with them daily were the least likely to get the vaccine. And the people who never interacted with them were the most likely to get the vaccine. I think the way I interpret this is that familiarity breeds contempt. Basically, I think that, as we know, most people that get COVID do well. And then these were people that saw people get COVID and they did relatively well, and they see it over and over again. So it's just not as scary to them because they've seen people do well. Whereas people that have never seen COVID, they just hear about it on the news, and the unknown is kind of scary to everyone. So I remember in my hospital when COVID first started, the nurses and the people that were going to work on the COVID unit were freaked out. They were scared, and they did not. They knew they needed to take care of the patients, but they were really scared. They wanted to get all the PPE. They wanted to get dressed up in pampers and like put the IV pumps outside the room and do all kinds of things. So, people were appropriately fearful. And then as the thing went on and they had lots of patients and they saw them over and over again, people just got less scared. People started just, they're like, put an N95 on, put some gloves on, put a little thing on, just go in there, do your business, take care of the patients. And it was kind of like became routine. So I think that's kind of what explains that mostly. Okay, so that's about vaccination. Not super interesting. I think that was the main interesting points that I saw was that thing. But okay, so take home point. Under the alpha variant conditions, the Pfizer vaccine is 85% protective against both asymptomatic and symptomatic disease. So what this study shows is that it does protect against asymptomatic disease. It does work against asymptomatic disease, and it does reduce transmission because if you don't get asymptomatic disease, then you can't transmit it. So at least from that standpoint. Now, what it doesn't say is if you do get it, are you less likely to transmit it? Like, does it reduce viral load? This study is not designed to answer that question. It's designed to answer the question of, do you get asymptomatic disease, and does it protect you against asymptomatic disease? And the answer is yes, it does. Now, this doesn't say that, is this true for Moderna? Is it true for Johnson & Johnson? We don't know that. This study is not designed to answer that question because mostly this is Pfizer in there. But seeing how those vaccines are similar, it probably is. It probably does. It probably holds true for the other vaccines. Does it hold true for Delta? Does it protect you against asymptomatic disease in Delta? And does it protect you to this extent for Delta. You know, the recent data that comes out says probably not. It's probably not as good because Delta is way more infectious. But there isn't studies of this power and this number to definitively answer that question for Delta. And these studies are hard to do. I mean, these people basically tested 25,000 people every 2 weeks for months on end to get this paper out. And that's these kinds of studies that are very good at answering these questions definitively are extremely expensive and difficult to do. And that's why it's hard to do it for like every single variant that comes out. And that's why like I was pretty excited about this paper when I heard when I heard about it, because it was, you know, it's very hard to get numbers this big and get this kind of high quality data. So yes, we don't know if this holds true for data for Delta. It probably isn't as good for Delta. Does it stop asymptomatic infection of Delta? We don't know that. This study's cannot answer that question, but probably to a lesser extent. But that's just my guess. All right, so I hope this was helpful. I will link this paper below. If you have comments, please comment below. Thank you.